Okay. Shall I
Okay.
start, Padma?
No, doctor, I'll get you introduced. Welcome to
Okay.
today's session on PCOS by Apollo Cradle and Children's Hospital. To speak on the topic, we would like to welcome Dr. Krishna Shah, who is our in-house consultant and senior in obstetrics and gynecology. She has done her MBBS DGO. We welcome you, doctor. You can now take over the session. Thank you.
Okay. Thank you, Padma. Thank you for your kind introduction. And thank you. Hi, everybody. Good afternoon. I'm Dr. Krishna Saw working in Apollo Cradle, Kormangala. I'm senior gynecologist working here for more than 10 years. And today I want to discuss with you about PCOD or PCOS, which is a very common problem nowadays. I think most of you know about PCOD, and literally it means PCOD or PCOS, Polycystic Ovarian Syndrome. Poly means many and cyst means small water bubbles. That is why, and in the ovary, when you see that water bubbles in the many bubbles, water bubbles in the ovary, then it is called PCOD. Actually, it is a ultrasound diagnosis. We see in this scan or ultrasound, not in anything else. So, what is PCOD and which age group will get PCOD? That I'll discuss first. First thing, like this is a disease of young generation, young population, young girls, young women at the childbearing age. That means about 14, 15 years it may start and goes up to 45, 46 years of age. First thing, like when you like how you know that what are the symptoms of polycystic ovary or PCOD problem, so that you will come to know, okay, now I have a doubt, or I think that I have PCOD problem. So first thing, most of the cases we what we see is the menstrual problems. Menstrual problems means variety of problems possible. It may be first and most common is the delayed periods. That means every 2 months, 3 months, 4 months, even up to 6 months, the girl or woman is not getting period. That means it's a worrisome, it's the girl gets worried, why I'm not getting the period for a period such a long time, and her parents also get worried, or the woman also get worried. That is one thing. And other menstrual, it actually I'll say that PCOD causes all kind of menstrual problems. It may cause all kind of menstrual problems. What I said, delayed period, that is the most common one. And after that, like before period spotting problem, after period spotting problem, heavy bleeding and less bleeding, or very little bleeding, or so heavy very heavy periods bleeding. So any kind of bleeding problems possible in case of polycystic ovary. That is one symptom you will note. And second one is like what we call more androgen hormones in your body, that will lead to like pimples, or what you call acne, facial pimples at the back of your neck, pimples, or the arm, upper part of the arms, pimples or acne. And hair fall, and that male pattern like hair growth in your chin area, or other like mustache type, what is called hirsutism, and blackening or darkening, dark patches behind your neck, or sometimes below your breast also. These are the androgenic features. And you come to know some like maybe I'm having polycystic ovary. And other than that, some other like you will have it is actually associated with the obesity or overweight woman or girl. Some girls may be lean or thin also, or normal weight or less weight also, but mostly we see it is associated with overweight. You keep on increasing weight, and you see the period changes, and what I said, like this like acne, hair fall, or a male pattern of hair growth and black patches, those things. And some women find difficulty in conceiving, that we call infertility or subfertility, means they are not able to conceive for long duration after having reasonable period of intercourse. Then you have some doubt, okay, they may be having polycystic ovary. So these are the symptoms you may face, and if, as I said, it mostly associated with the like obesity or overweight. So it creates lot of other hormonal changes also, and including that diabetes or insulin resistance, which causes a variety of other changes, other hormonal changes, which leads to your all these kind of problems. And if it is not treated on time, if you do not take proper treatment and precaution, then what happens, like later part of life, it may long standing polycystic ovary, it may lead to high blood pressure, diabetes mellitus or diabetes problem, heart problem, and some cases like that endometrium or the uterus, the inner lining of your uterus, which is called endometrium, it grows rapidly, that overgrowth of endometrium, and which really leads to uterine cancer. And some cases, as I said, if the girl or woman is not getting pregnant or not getting periods properly, then she gets upset, and she may face anxiety, depression, sleep disorders, and other social problems also, like the family is not happy, all those kind of problems also happen. So I want to tell you when to see doctor. When to see doctors means, if you face problems like your period is not happening, see, first, one most important thing I want to tell you, like 1 week 7 days early or late menstrual cycle is considered as normal. That means if you have a cycle of 25 days or up to 35 days, that much duration period, if it is happening, that is considered as normal. And the normal menstrual flow, it should be somewhere between 30, 40, 50, 60 ml throughout the period 4, 5, 6 days cycle. That is normal. So if you experience like 40 days cycle, 45 days, 50 days, even a 2, 3 month cycle, that it's something abnormal. And if you see, as I told you, hair fall or pimples, or gaining overweight, you are getting overweight, increasing body weight, and having like hirsutism, or like chin hairs, or other male pattern of hairs, excess hair fall, dark patches, as I said, below your neck, backside of your neck. So if you face this and difficulty in conceiving, not having no, not able to conceive after considerable time of trial, so in this condition you should meet doctor. You should come to doctor and show your and talk to doctor about your problems. So how will diagnose the polycystic ovary or PCOD? How it is diagnosed? So first thing, your clinical symptoms will be asked. You should come with a menstrual calendar or diary. How many dates you've had periods, and which day you, how late or how early you getting bleeding. That you should note down for your it will be easy for your doctor to check the cycle length. So that we ask for menstrual calendar or menstrual diary. And then, and after the clinical symptoms, we'll do some, after asking your clinical symptoms, we'll ask you to do some blood test. Doctor can diagnose your PCOD problem by doing some blood test, which includes the hormones and normally associated with thyroid problems. So we ask for thyroid, complete blood count, sugar test, thyroid test. These commonly asked, and different hormones like gynecological hormones, FSH, LH, androgens, as I said, testosterone, insulin, because insulin resistance is no, it is known in cases of PCOD. So insulin, one hormone, and other like if you are trying for pregnancy, some other hormones like estrogen, progesterone, and AMH, anti-mullerian hormone, and these tests are done according to your need, your age. Doctor will select that, and ultrasound is required to diagnose the polycystic ovary. So but the criteria for diagnosing the polycystic ovary is not the only the ultrasound. Ultrasound will show us the water bubbles. The ovaries become bulky, which means the bigger than the normal size. Normal size ovaries, say for it will be 10 cubic centimeter, 10 cc size. So conditions of, in cases of polycystic ovary, the size of the ovaries increase, and the polycystic, as I said, many cysts, multiple cysts, small bubbles in the ovary, that is visible in the ultrasound. And the central portion of the ovary, which is called stroma, that also bulges, it becomes prominent, so that ultrasonologist doctor can say that okay, you have polycystic ovary in one ovary or in both ovaries, right ovary, left ovary, he will tell. But that is not the only criteria to say that you have PCOD problem. Polycystic ovary, actually, that proper diagnosis is, for proper diagnosis there should be 2 points. 2 points means one is the, your like as I said, delayed period, irregular period, that is number 1 point, it should be there. Or you have that features of male hormones or androgenism, that is like pimples, acne, or male pattern of hair growth, mustache, and chin hairs or black patches. These things together call androgenism. So either you should have the menstrual problems, or you should have that male pattern of hair growth plus the polycystic ovary seen in the ultrasound. At least two criteria should be there, either male pattern of hair growth and the polycystic ovary in the ultrasound, or delayed periods, or irregular periods and polycystic ovary in the ultrasound. So two things should be there among these three, and then it can be diagnosed. It should be diagnosed as polycystic ovary. If the girl is having regular periods and that ultrasound is showing only water bubbles, and then the showing PCOD pattern, actually she is not having polycystic ovary, because her periods are regular, hormones are balanced. Many times we see when the girl is taking some hormonal tablets, say for oral contraceptive pills, that's 21 tablets, it is given cyclically as birth control, or many other cases for other treatment also. Then also we see that water bubbles in the ovary, and ultrasound will show the picture of polycystic ovary. Then we will not diagnose it as PCOD because she has regular periods. So that is how we should do the correct diagnosis. And after that, as I said, some blood test also required to diagnose this polycystic ovary problem. So treatment wise, I'll tell you how to treat this polycystic ovary. First, like start from the younger age. If the girl is like, if you are less than like 25 years, starting from puberty or starting from your menstruation menarche, if you see that the problems of irregular period, weight gain, and other male pattern of hair growth, pimples, those things, and you are still not married, then we don't ask for, we see the your clinical symptoms, your clinical examination. And we do not ask for, we should not be you should not be asked for so many blood tests not required, your CBC, that complete blood count, sugar and thyroid test, and few other tests, maybe FSH, should be done. And ultrasound will show that polycystic bubbles and your clinical features. Treatment also will be different than other people. Like younger age, when you are not planning pregnancy, only you are worrying about your delayed periods or hair growth, pimples, and like you are obese or overweight. For that, first thing will suggest dietary changes, health, good, healthy food. Healthy food, what we mean to say that healthy food? Healthy food means you first of all you should avoid fast food and junk food. Normally nowadays what we see in our hospitals, people here they are doing all software job or computer jobs. They are sitting in a chair and doing sedentary. That's lifestyle has become sedentary, and they are ordering food and taking, which is unhealthy food, more in high calorie or high fat content, high carbohydrate content. What is the that is that one is, I we believe that it is the basic, one of the dominant region or prominent region to have polycystic ovary in these young girls in this generation. So eat healthy and do exercise is the first line of treatment. And where they should not eat fast food, junk food. They should avoid fast food, junk food, and excess eating rice also, white rice also not good. Carbohydrate you should control, and mostly they should eat high fiber food, which is low in glycemic index. High fiber food means whole grains. Here we get that ragi, millets, jowar, bajra, corn, these whole grains. Even brown rice is better. Sprouts, oats, sweet corns, these things should be added in your diet. And eat lots of vegetables, eat fruits, and don't eat chips, kurkure, or kind of packed snacks, chocolates, biscuits, that you have to avoid, not that many. And home cooked food, and add more, mostly more fruits in your diet, more salads, sprouts, some this badam and nuts, like what you call almond, walnut. These are good for your health. So each meal should contain less carbohydrate, less oil items, and more protein should be there. More protein, less carbohydrate, more veggies. You can eat fish is better for PCOD problems, and this one, like eggs are better. And milk and dairy items should be less. Always we suggest dairy items should be less. And do lot of exercise regularly. You should do exercise according to your, or body weight, and all. 30 to 40-minute regular exercise is required. You can join gym, or you can do cycling, or whatever possible in get some time for you. And second thing, after all these healthy food, exercise and all, second, if the period is really irregular and it is bothering you, like anytime you getting spotting, bleeding, and you cannot predict when you will get the period, then hormonal tablets are second line for these young girls. Hormonal tablets means oral contraceptive pills or progesterone only pills are suggested. Other than that, some other supplement kind of tablets are available, which contains those protein-like things like myoinositol, chiroinositol, and other pilocarpine, other ingredients, and including vitamin D and calcium, which comes in the which are available in powder form or tablet form, which has least side effects. Those are also good. It's like supplements only. And third thing is, if the girl is overweight or obese, and that sugar is towards the higher side, they benefit by taking metformin also, that it helps to reduce insulin resistance and regularize the period cycles. So it is also better, but some people may face little side effects like gastric problem. So always I suggest start with healthy food and the exercise, and they in long term they benefit. So for younger people, this is the main treatment: healthy food, diet, exercise. Second is hormones, oral contraceptive pills or progesterones, and supplements like myoinositol, chiroinositol, and vitamin supplements. And next is the next kind of people like who are looking for becoming pregnant but not able to conceive, not able to become pregnant. For those, we need to do all kind of more blood tests, more and more blood tests required for them, not for all people but for them. Normally we suggest to do that follicular stimulating hormone, FSH, LH, and prolactin also required, thyroid test required, and glucose tolerance test, insulin test, testosterone, which is a male hormone which causes delayed ovulation or irregular ovulation, means egg formation is disturbed by that. So this kind of test, especially these tests should be done second day or third day of period, not any day of period, not haphazard way, especially for the FSH, LH, and AMH, that is anti-Mullerian hormone. These tests should be done particularly on the second or third day of period, so that we'll come to know which is high or which is low, because these hormones, especially the estrogen, progesterone, FSH, LH, they do change during the period cycle. The second day some range, and mid cycle some range, and near before period some other range you will see. So second or third day you should choose, and it should be done on that those days only. Normally in this PCOD problem, we see that LH hormone will be high, LH FSH ratio that changes. It LH becomes almost double than FSH. Insulin will be higher, but it does not work. That means there will be insulin resistance. AMH, that is called anti-Mullerian hormone, which is in common words you can say it is the, it reflects your egg forming capacity, means how many eggs in reserve in you are having in your body, and how many eggs approximately some idea will have, that how many eggs you can form. In these PCOD problems, what we see high AMH hormone. High AMH means you, if you take inducing tablets, egg forming tablets for pregnancy, then it will it will help the doctor to diagnose how much dose should be given, because sometimes when we give ovulation induction egg forming medicines, it may cause side effects, and a larger than required eggs may be formed. So for these for to avoid these problems, we should do all these tests. And then for pregnancy, we should start normally this young ladies for pregnancy they get benefited by giving by taking egg forming tablets, which we give. Many tablets are available, like first is letrozole, clomiphene citrate, tamoxifen. These tablets are given. And sometimes we see associated thyroid problem also, which is very common. So thyroid test also, thyroid tablet also should be started. And if the and then after giving tablets, we'll do that follicular scan depending upon your response, starting from 8th day, 10th day. That follicular scan means egg size will be checked alternate day according to the response. If the egg size is not adequate, if the size is not adequate, then and the lady may be given injections, gonadotropin injections are added. And again that follicular scan alternate day is done to see the size of the egg. Once the adequate size of the egg is achieved, then other gonadotropin is given for egg release, and so it helps in conceiving. And some people, even this treatment may not work out. And in those people who are average weight or little overweight, some cases they may benefit by doing laparoscopic ovarian drilling also. Drilling means small holes are made in that both the ovaries, 5 6 holes are made, so that through the laparoscope, so that over time, after 6 7 months, the ovaries will form eggs naturally. And otherwise, some like low dose of egg forming tablets will help to form the eggs. So this way we treat these pregnant ladies who wish to become pregnant. Other than that, these people also should continue doing like diet, exercise, similar as I told younger people, similar as they should also do the diet and exercise part. And it helps if they reduce even 10 20% care of the body weight. Many a times it helps to easily form the eggs and to become pregnant, because the hormone imbalance starts from that overweight, obesity, and bad fat in the body. And it even if they should concentrate on eating and healthy diet and exercise, because some cases it is possible that even she conceives that air quality and her body hormones may not be so good, so that she may not continue that pregnancy. It may end up in miscarriage, or sometimes preterm delivery also possible. So for that purpose, this healthy food, exercise is very important. And for to conceive, this metformin also helps. That metformin in and myoinositol, chiroinositol, all these tablets also given to conceive or to continue pregnancy for this purpose. And third group, like as I said, when you completed your family, when you completed your family and you are little, 35 plus or 40 plus or so, and still you are having these problems of as I said, like delayed periods, or you are having irregular periods, or in between periods, spotting, bleeding, heavy bleeding. You cannot predict when you will get period. After finishing period, you start spotting. Before period, you start spotting. It is bothering you, or you get lot of hair fall, or like hirsutism means chin hair, or pimples, acne, so many acne. And when you've completed family, then you are not, you don't need to do so many blood tests. Only a few blood tests and ultrasound will be enough. At this age, we should, you should get proper treatment. Here also, same diet, exercise has significant role. After that, hormone tablets are suggested. And there is a risk of, some people may get that. Oh, and when you see the ultrasound, that endometrium, inner lining of uterus may be growing, that overgrowth of endometrium. At this age, people will be at more risk of having that endometrial overgrowth, which may later, in few cases, lead to uterine cancer or endometrial cancer, which should be taken care of properly. And other than that, like overweight and obesity may cause lot of problems. As I said, diabetes, heart problem, high blood pressure, and your bone joints problems, and liver, like non-alcoholic fatty liver problem. And it is some most cases it is associated with thyroid also. So it should be treated properly, and it should be, like you should be guided properly to avoid all kind of these health problems. I think I discussed most of the points, Padma. So, if anybody have any question, anybody has any question, they can come forward and ask. I'm open for that. Padma, I had to print.
What's the question?
No question here. There is no question here.
Okay, I'm done with that.